Titamed Spinal System consists of 4 different types of screws. The most common screws that most surgeons are familiar with is the polyaxial screw. Polyaxial, the screw rotates 360 degrees, mobile until it is locked. The Ti-TaMED system also has the mobile screw, which is a uniaxial screw. It rotates on one plane only, and on the other plane acts as a rigid screw. This screw, when the rod is in, the cap is on, and you lock it, it still remains mobile. The next screw is the uniaxial locking screw. Again, rotates on one plane, rigid on the other plane. When you put the rod in, you put the cap on, and you tighten, it locks, such as the polyaxial screw does. And then we have the rigid screw, which a lot of people refer to as a monoaxial screw. This is the rigid screw that we have. They all incorporate the very similar design head, so they all take the same grub screw, and except for the insert tools, all the other screws in the Ti-TaMED system are common in inserting these screws into the spine. Some of the key features of the Titamed Spinal System is that we provide a rod tray that consists of the round rod, which is the standard rod up to 100 millimeter, and a hex rod from approximately 50 millimeters up to 220, where if you need to do any sort of correction, then you can do rod rotation with a hex rod rotator. We try and make it very easy for the surgeons and the sisters, so that they don't have to cut the rods to sizes. From the very small ones, they start at 40 millimeters, 45, 50, and then from there it goes up in 10 millimeter increments. We pack in one tray, and they're all clearly marked mobile, locking, polyaxial, rigid. You'll note that they get demarcated into an area where you'll have, like for the mobiles, you'll see on the left hand side we have different sizes of 4.5 millimeter diameter with the different lengths. Middle, the most common, 6 millimeter diameter, different lengths. On the right hand side, not the extreme right, you'll have 7 millimeters, different lengths. And then we have the 8 millimeters for those special occasions where you need, either through revision surgery or very soft bone where the pedicles are big enough, you can put in an 8 millimeter screw. Note, they don't come in 8 millimeter in the polyaxial, just in the mobile, locking, and in the rigid. They're also modularly packed, that should you not use, say, the mobile screw, but you only use polyaxials and rigid, you can have extra polyaxials or rigids on the same tray, so that you have enough for a couple of procedures or for some very long procedures. We've now just added on top of the screw tray the grub screw tray, just to show you how the grub screws come packed. These grub screws are compatible with all the different types of screws, so you don't have to have different caps or grub screws for the different screws. We have the tool, which is the hex tightener. You'll notice all our tools are marked and clearly marked with their names for easy identification. To load a grub screw, we strongly recommend a little bit of wax on the tip. Insert it in, and you remove. That's how the grub screw gets it fixed to the screw head tightener. A quick demonstration on how one of the more important tools, our approximator, works. You'll see it's marked approximator on the top. As I said, we mark all our tools. With the new design head, approximator, you take the wings, you push it halfway down this gap. You'll push it over the top of the screw head. It clicks in, and you push the wings all the way down to the bottom. The head is now attached to the approximator. The rod will be sitting inside there. You will turn this knob down. You'll see that the legs start going down. The head gets pulled up into the rod. we finally get to a position where the rod and the head are sitting nicely. You take your hex tightener with a grub screw on the top, the black at the bottom. As it's a buttress thread, it can only go in one way. Slip it into the top, screw it down. Remove, screw all the way to the top to lift the legs, lift up the wings, and there the rod has been attached to there the rod has attached itself to the head. One of the important features is we have a slot and not just a hole. There's also a little lip on the edge of our hex tightener, which means that once it's in position, it is at 90 degrees to the head, which means when you drop the hex tightener and the grub screw down the shaft, it's at 90 degrees and the chances of cross-threading is almost minimal. This is the uni-axial insert tool. As most other systems, there's a hex in the top. There's a hex in the top. You find the hex, drop that in, screw that on, and here you have your hex, your polyaxial screw onto your hex tightener in 360 degrees, as rigid as anything, straight and for insertion. To loosen that, and pull up. The uni-axial. That's the uni-axial insert tool. There's a fork at the end and the profile on the inside, so it's self-finding. Again, all you do is hold the screw fairly straight, put that in and turn. Once it's in, you'll notice that it's completely rigid, completely straight. It doesn't matter at what angle you're in, there will be no give on any side. To try and demonstrate to you the difference between the polyaxial and the uni-axial screw is that the uni-axial screw, being mobile on one plane, allows us, when we rotate the rod, to translate the screw into a new position. Where with a polyaxial screw, you will firstly get the head tilting over to that position, and then only, depending on the degree of translation, you may get a slight bit of translation. So in other words, the uni-axial screw is like a polyaxial screw on the one plane, and on the other plane it's a rigid screw. To try and demonstrate how you would use the uni-axial screws in terms of posterior scoliosis, I've inserted, these are the old type screws, just for demonstration. However, they are exactly the same as the uni-axial, as the new uni-axial, the functionality of it. I have inserted the screws through the pedicle. You'll notice there is a scoliosis curve. We have sort of bent the rod to accommodate the curve, and now we want to do a scoli correction posteriorly. We use the hex rod. We put the hex rod rotator in, and as I start rotating the rod, the screws will translate, and you will see how it automatically corrects the scoliosis. At the same time that it corrects the scoliosis, it gives us a lordosis. However, because we're rotating the rod, we can decide at what stage we want to stop the correction. If there's going to be an imbalance, you can stop in that position. If you don't want too much lordosis, you can also stop in that position. You are not committed to a beginning and an end in this technique. You can overextend to the other side, you can go back. So you can play with your scoliosis correction as well as your lordosis. For anterior scoliosis, we mount the screws in an arc. We can't do it in this case because there's a piece of wire on the inside holding this whole plastic spine together. Together with the tooling, you will get the rod, you'll bend the rod to your estimated amount of correction. that you'll either need in kyphosis or lordosis. These are the uniaxial screws that as you put the screw in, you'll notice that the screw head and shank will always be at 90 degrees. Screw head and rod, sorry, not shank. When you do a correction, you will rotate the rod, and as you rotate the rod, you will notice you get a scoli correction, and at the same time you'll get either kyphosis or lordosis that you require. You can go as far as you need to go. You are not committed to a beginning and an end. You can stop in that plane should you have enough balance, or you can go right to the end and go for the perfect correction if you feel you've got enough balance after correcting. You'll notice what happens here is that as we change the angle of the rod, the head staying at 90 degrees will be accommodated by the mobile shank, so there will be no stress on any single one of those vertebrae. Another thing is the screw will go through cortex, come out the other side, so you've got it biting on two sides of the vertebral body, in the cortex, the harder bone. What we also do is we mount it either in that angle or at that angle from end plate to end plate, so you get an angled shank with a right angled head to the rod, which will also increase the pull-out strength. You then lock the screws, and if need be you can even do a reduction on each individual one. As you squeeze, it will reduce itself a little more on the opposite side. It can only be done with a uniaxial screw, because as we rotate the rod, it will translate, and that will give us the correction we want. You cannot do this with a polyaxial screw.